Hi there, I'm Dr. Ron Brown, Medical Director of True Balance Hormone Therapy Clinic, and I would like to welcome you on your journey for hormone restoration. True Balance has been conducting bioidentical hormone therapy since 2007, and I'm very proud to be the Medical Director of True Balance. I'm an OBGYN, graduated in 1995, and have practiced in a community hospital in the Edmonton area since 1995. How True Balance came to be is basically a story of a hormone replacement consultation. In 2006, as a conventional OBGYN physician, I was sent a woman for consultation regarding hormone replacement therapy. At that time, I gave her the same consultation that she would receive now, many years later. And at the end of the consultation, she said, "What do you know about bioidentical hormones?" And I said, "I don't know anything about bioidentical hormones," even though I had heard a few whispers about things, but really didn't know anything of substance. So I said, "I don't know anything about bioidentical hormones." And then she said the phrase, or asked the question, that would further change my life. And that was, she asked me, "Doesn't that embarrass you as an expert in women's health that you don't know anything about an area of your expertise?" Because I work in Canada and have done it for a long period of time, I said at that time, no, it didn't bother me at all. And we exchanged goodbyes, and off she went very politely and nicely. The problem was that it actually did bother me that I didn't know anything about bioidentical hormones. But I thought at that time in 2006, if I didn't know anything and I was a practicing OBGYN, then what I didn't know wasn't very important, but maybe I should just learn a little bit so I would be certain that it wasn't important. So I looked around for a conference in Canada and couldn't find one. And to this day, there are no significant bioidentical hormone conferences in Canada. Finally, I was able to locate one down in Denver. I went down and over the course of 3 days was blown away by the information presented there. And the reason that I was blown away was because it was the same information and scientific support that I used to support conventional hormone replacement therapy. However, they were using it in a slightly different slant to support bioidentical hormone therapy, and their spiel sounded better than my spiel. And that started a journey where I started learning more and more about bioidentical hormone therapy. I eventually became board certified in Functional and Regenerative Medicine with the American Academy of Anti-Aging. And because True Balance also had been operating as a Medi-Spa facility for the previous 7 years before 2006, I was able to then start a bioidentical hormone practice. And so I started seeing patients, helping them with bioidentical hormone therapy. In the ensuing years, I've developed with a group of other physicians and bioidentical hormone specialists a program that has turned into the largest bioidentical hormone practice in Canada, and most likely the largest practice in all of North America. I work with a group of physicians and hormone specialists in order to provide you with quality care that can significantly elevate your well-being and quality of life. So a lot of people wonder why here in these days, so many years after 2007, we're still fighting the same battles when it comes to conventional hormone replacement therapy against bioidentical hormone replacement therapy. It's actually an interesting story, and it starts off historically with the development of the first estrogen for women, post-menopausal women, and that was a drug called Premarin. And that was derived from pregnant mare's urine. That's where they got Premarin from, pregnant mare's urine. And they found a way to make estrogen out of that urine compound. They gave it to women. This was back in the 60s. They gave it to women, and women, postmenopausal women, felt dramatically better. dramatically better. Their hot flashes and flushes went away, their skin came back to normal, their energy levels improved, vaginal dryness went away. It was a game changer. So everything carried along fine until, after using Premarin for 5 to 10 years, it was detected that by just using Premarin alone in a daily pill form, women that had not had a hysterectomy would develop an increased risk of uterine cancer. So that was judged to be unacceptable, and so medications were developed to prevent that from happening. And so the primary medication at that time was a drug called Prevera, and Prevera was given 7 days out of each month. It would induce a period and prevent the development of uterine cancer. But the problem was, in postmenopausal women, if you ask a series of postmenopausal women what's the only advantage to the menopause, they'll tell you it's the fact that they don't have periods anymore. This regime of using Premarin every day of the month and Prevera for 7 days a month completely got rid of menopausal symptoms, prevented uterine cancer, but it gave menopausal women a period again, and they said that was unacceptable. Now, the only benefit to the menopause was no periods. So Wyeth, the company involved in these two medications, decided, let's start giving Prevera on a daily lower dose basis. So every day women would take a Premarin and a Prevera. Eventually they put them together and it was called PremPro. And so PremPro was used on a regular basis. Everything appeared to be great. What was also noticed when they were using Premarin alone was there was a reduction in the risk of breast cancer. There was also a reduction in the risk of heart disease. So eventually the executives in Wyeth decided, hey, we've got a medication that might be a target for all postmenopausal women. So we've got a medication that's potentially good for half the population after the age of about 50, lasting the rest of their lives. That would be, in pharmaceutical terms, a home run. So Wyeth and the FDA decided to go ahead with the largest study looking at hormone replacement therapy to date at that time, called the Women's Health Initiative. And unless you understand the little basics of the Women's Health Initiative, you won't understand why hormone replacement therapy and bioidentical hormone replacement therapy are at odds with each other. So they developed the Women's Health Initiative. There was three large groups. One group was a control group where nothing was done. Another group was a group of women who had had a hysterectomy, and so they were allowed to just take Premarin alone. And then a third group was women who still had a uterus but were postmenopausal, and so they took PremPro every day. What happened over the course of the next 7 to 10 years was they found that in the PremPro group, there was an increased risk of breast cancer and of heart disease compared to the control group, which weren't taking anything. So they stopped that arm of the study. What they also found was in the Premarin only group of women, there was a reduction in the risk of breast cancer, there was a reduction in the risk of heart disease, but unfortunately there was an increased risk of blood clots, and so eventually that arm of the study was broken. So as it panned out, the Women's Health Initiative was unable to prove for asymptomatic women that continuous combined therapy with Premarin and Prevera resulted in improvements in health outcomes and quality of life. This was devastating for hormone replacement therapy at that time. At the end, the guru of hormone replacement therapy basically said there is no scientific basis for recommending or not recommending hormone replacement therapy, and in fact it's simply whatever a physician and the patient decide to do based on the available evidence, which is very mixed. With bioidentical hormone therapy, a lot more attention was paid to the Women's Health Initiative, and so some of the things that came out of this was some surprising information that everyone glossed over because of the untoward effects. But the bottom line was Prevera, when it was used just 7 days out of the month, had no adverse effect on heart disease or breast cancer. But when they changed the formulation to give it every day, that's when Prevera, the progesterone lookalike to counterpart Premarin, Prevera given every day caused an increased risk of heart disease and breast cancer. In what was surprising and what a lot of people didn't look at was, well, when we talk about breast cancer and estrogen, we always think of estrogen as increasing the risk of breast cancer. So why in the Premarin only arm was there a 30% or 23% reduction in the risk of breast cancer? It didn't make sense, except on the basis of estrogen or Premarin being a very, very weak estrogen that has actually some breast protective effects to it. And it turns out that in bioidentical hormone therapy, we use a very sophisticated blend of estradiol and a hormone called estriol that's been shown to protect against breast cancer. And we use those two estrogens together in a mixture of 20% estradiol, which is the very powerful estrogen, and 80% estriol, which is the breast protective part of the estrogen combination. The net effect is we get rid of all the estrogen deprivation symptoms, but we do not increase, and in fact most likely decrease, the risk of breast cancer over a woman not taking hormones at all. So that's one of the reasons that bioidentical hormones has been such a significant game changer. Unfortunately for Wyeth, it came too late because Wyeth actually went broke and was bought out by another company because the economic consequences of the Women's Health Initiative for Wyeth were so significant that they basically went out of business. A lot of people ask, well, why doesn't conventional hormone replacement therapy produce bioidentical hormones? And the reason is, again, this is a story, and it's all related to something called patent protection. So the pharmaceutical industry relies on certain concepts. A basic concept is you are not allowed to be granted a patent for a naturally occurring substance. So you can't patent estradiol, estriol, progesterone, testosterone. These are all naturally occurring compounds. You can patent a delivery system. So progesterone, for a period of time, about 20 years, had a patent on the delivery system called micronization that allowed it to get through the stomach without being digested. But now that patent is up. Without a patent, you can't make significant profits. Without significant profits, you can't support your research and development costs, and that's why the conventional pharmaceutical industry has never gotten involved with bioidentical hormones because A, there's not a significant amount of profit to be made. B, many of these companies were around when Wyeth was doing its project and therefore saw the economic consequences of making a bad decision. And the offshoot of this is that, for better or for worse, the pharmaceutical industry funds a lot of research and development. And because this area has been judged to be a no-profit zone and potentially quite dangerous, there's been very little, if any, significant research and development, and certainly none with bioidentical hormones because, again, there's no money to be made. A lot of patients will ask me, well, who is a good candidate for bioidentical hormone therapy? And it's actually a great question. In my mind, there's sort of two main groups which encompass an awful lot of women. One of those groups is the pre-menopausal or perimenopausal woman who's still having a menstrual cycle, could be regular or irregular, often struggling with excess weight, heavy bleeding, poor sleep, anxiety, or low energy. So that group of perimenopausal and premenopausal women are the group that I call estrogen dominant. Many of their symptoms are related to an imbalance of their estrogen and progesterone within their body. And this leads into another concept, which is we tend to try and always blame just one thing. But it turns out that the way people are feeling nowadays, or how poorly they're feeling, is actually multifactorial. Our environment is filled up with herbicides, pesticides, and chemicals, many of which we don't know the exact effects on the body, but at least some of them look like estrogen. So these are called xenoestrogens, quite often in herbicides and pesticides. And xenoestrogens look like estrogen and therefore increase the estrogen load of the body, but the body's unable to increase the progesterone load to keep a woman balanced. And I always like to tell my patients, I think of women as hormone teeter-totters. Your main teeter-totter is your estrogen-progesterone balance. When it's good, you're feeling great. When it's out of balance, meaning estrogen dominant, most women will experience that on a monthly basis based on PMS. And PMS is just a behavioral representation of your estrogen-progesterone balance in real time. For most women, thankfully, that period of time is only experienced for 3 to 4 days. It resolves when the period starts, and it's very individual how each woman experiences that. When you add a whole bunch of xenoestrogens and chemicals, you ramp up the estrogen side of the equation and the body can't keep on the progesterone side. So it's like being in PMS all the time. Weight gain, poor sleep, anxiety, low energy are really the common results of this imbalance, and bioidentical hormone therapy allows us to address that imbalance for estrogen dominant women. The flip side of the coin is the other main group of women that are really ideal targets for bioidentical hormone therapy are postmenopausal women. So these are women that have stopped having periods, their estrogen levels have gone very low, their progesterone levels are low, their testosterone levels are low, all these hormone levels are low, and they feel it. They feel it in the fact they get hot flushes and flashes and therefore even worse sleep than when they were premenopausal and just having insomnia. They get changes to their hair, skin, and nails that they don't like, and they develop vaginal dryness, which interferes with intimacy with their partner. So postmenopausal women are an ideal target, and that's actually how our program for bioidentical hormone therapy started, and then morphed into some of these other areas where we've been able to find our program of assistance to women. At the end of the day, what we're really talking about is something called quality of life and functional capacity. In my world, quality of life means I have to remember who I am and I have to be able to live unassisted at home. I don't want to live when I don't remember who I am and who my loved ones are, and I don't want to continue life if I have to be in a care facility and someone doing activities of daily living for me. The other side of the coin is something called functional capacity, and that allows me to basically enjoy the aspects of life that I want. And all of bioidentical hormone therapy is aimed at promotion of quality of life and preservation of functional capacity, which allows us to remain unassisted at home. The way I like to think about it is, I believe our sex hormones for women, estrogen, progesterone, and testosterone, are the most powerful anti-inflammatories that we have acting in our body. The reason they're so powerful is these sex hormones actually act on our DNA, and they produce compounds that dramatically reduce inflammation, and they block the production of compounds that cause inflammation. So they're a double-edged sword, reducing inflammation. Why is that so important? Nowadays, almost everyone agrees that the vast majority of chronic diseases that we see nowadays are related to inflammation, increased levels of inflammation, including diabetes, heart disease, cancer, Alzheimer's. The list goes on. And I believe bioidentical hormone therapy fits the bill for improving quality of life, improving or preserving functional capacity, reducing levels of inflammation, making people feel dramatically better, and not increasing the risk of breast cancer or any other hormone-dependent cancers. Once your blood work is completed, you can get in touch with True Balance and book your hormone consultation. Basically, this is an hour-long appointment with a hormone specialist who has received extensive training in all aspects of hormone replacement therapy as it relates to medical history and pre-existing diseases that may be there. There's a detailed and exhaustive look at your past medical history, present medications, allergies, past surgical history, family history. Then we dive into a symptom inventory of how you're feeling as it relates to certain of the hormones, which show up in very specific patterns. By the time the hour consultation is done, we're able to take your blood work, your symptom inventory, your past medical and present medical history, put them all together and develop a comprehensive plan meant to move you towards a better level of quality of life and just generally feeling better. The majority of our patients feel dramatically better after 8 to 10 weeks of being on therapy. One of the advantages of this program is that we are able to measure some of these sex hormones as we're supplementing you, so that we can ensure that not only do we hit target ranges to make sure that your symptoms will go away, but also to make sure that we stay within what I consider to be the safe margin, where we don't exceed those levels and therefore possibly put you at risk. So we not only improve how you feel, but I believe our program is designed to keep you safe. I work with a significant group of physicians, nurse practitioners, hormone specialists, and have created what I think is truly a high-quality, reproducible bioidentical hormone replacement therapy program. I'm really excited that you're watching this video. I'm looking forward to having members of our team take care of you and trust that we can move you towards an area where I just want you to be able to show up as the best version of you in life every day, enriching the lives of your friends and family and having improved quality of life. Thank you very much and have a great day.